It's with immense pleasure that I welcome back to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices, my friend of many decades, Dr. Jim Fleshman. Dr. Fleshman is, of course, the Chief of Surgery at Baylor University Medical Center in Dallas and the Colorectal Surgery Regent to the American College of Surgeons. Welcome, Jim.
Well, thank you, Steve. It's great to see you, and it's great to be with you on this day.
Always a pleasure to see you. I'd prefer that it was in person, and hopefully it soon will be.
I have the same sentiment. It's been too long.
Absolutely. In the interim, we can remotely discuss Colorectal Cancer Awareness Month, March. And as the Colorectal Surgery Regent, I could think of nobody better to enlighten us about the importance of screening. But maybe you can touch upon the current screening recommendations, and then maybe we can go into a little bit of the impact of the pandemic on screening.
So, this is a great time of year for us to remind people that they can actually save their own lives or save the lives of their family members just by thinking about the risk of colon cancer and the simple things that we can do to prevent the disease and to detect the disease. I would prefer that people think of it as life-saving and a routine part of your healthcare to get a colonoscopy when you're supposed to, or use some other screening method. We now think that people under the age of 50, probably around 45, should be getting screened because we have a higher incidence occurring in younger people. We don't know why. It's not all genetically related, but if your family history is positive for people who have had polyps or cancer, it's a simple thing to, at 45 years old, or at least 10 years before the patient in your family got cancer, to get a colonoscopy. A lot of people don't like to think about getting colonoscopies. It involves a prep. So there are people who are now going to a DNA test in the stool. Unfortunately, that detects tumor. It doesn't give you the option of preventing tumor. And then there are other folks who are still using blood in the stool and short flexible sigmoidoscopy to detect polyps or cancer. But some method to really look at whether or not you might have a malignancy or a pre-malignant or a polyp or a tumor in your colon.
Sounds like from what you said, the DNA tests wouldn't necessarily detect the pre-malignant lesions.
They don't. It has to be a fairly aggressive polyp that has advanced almost to the point of cancer, or it has cancer within it somewhere before they can actually find the DNA in the stool. The beauty of a colonoscopy, besides the nap that you get from propofol during the colonoscopy, is that it actually can find a polyp, remove the polyp without an operation, and then you're cleared for 5 to 10 years. So I still prefer that recommendation than anything else.
That's very cogent, and I absolutely do agree with you. So speaking of screening and polyps, of course, the reason we screen is to find, hopefully, polyps while they're pre-malignant and remove them before they're malignant. But screening was interrupted by the pandemic. And I'm wondering if you have any sense of to what degree it was interrupted.
I think it was probably less than 50% of the people who were candidates for screening got screened during the pandemic for that 1 year. And then after that, it came back. And I think we haven't seen an overshoot yet of people coming back to get it, but everybody's back up to speed with the level that they're supposed to be at. We think that the risk of coming into a facility that's accustomed to taking care of patients with COVID, knows how to prevent transmission, it's a safe mechanism. I got mine done during the pandemic, and my wife got hers done. I went to the endoscopy suite here in the hospital. She went to a physician's daycare center down 2 blocks from here, and everything went fine. It's worth it, and it can save your life. And I tell all of my patients that, and I try to get them to agree that they're going to do this. And it's usually the man and the wife telling the man to get the screening. And so I'm right there with her, telling him to get it done.
I think that's a great note on which to end, that screening colonoscopy saves lives. And the highest testimony is that you and Linda both had your colonoscopies recently. And I certainly do mine on a regular basis, despite no family history. I think that it is indeed wise. So thanks for helping raise the awareness for everybody of Colorectal Cancer Awareness Month. Thanks again for your time today. Always a pleasure, Jim.
It's always a pleasure, Steve. It's great to see you. And thanks for including me.